Hi guys, this is Dr. T, and yeah, welcome to Clinical Medicine with Dr. T. Let me show myself to the camera. People are saying that I'm hiding. Guys, I'm not hiding. The space is not enough to show the content, to show this board behind me, and also show myself. So please bear with me. Okay, so guys, let us continue with our psychotic disorders. Psychotic disorders. Like I said, in the DSM-5, these disorders are now called schizophrenia spectrum and other psychotic disorders. But for me, it doesn't change that they are still psychotic disorders. So that's why I'm gonna write psychotic disorders here. Okay, so we said that, and I'm gonna keep saying this, we said that psychotic disorders, they share symptoms. One symptom that they share is delusions. Number 2, hallucinations. Number 3, disorganized speech. Number 4, disorganized behavior. Disorganized behavior. So these are the 4 symptom domains that all psychotic disorders share. And we learned yesterday that, so we spoke about brief psychotic disorder, and we learned that for someone to be diagnosed with a brief psychotic disorder, they must have at least one or more of these symptoms, and one symptom must either be a delusion, hallucination, or a disorganized speech. So if you've got, let's say you've got 2 symptoms from these 4 domains, then it means one of these symptoms must either be this or this or this. So if you've got only one, that one symptom must either be a delusion or a hallucination or a disorganized speech. That's what we said yesterday. So please guys, go and watch that tutorial on brief psychotic disorder. Today I want us to talk about schizophreniform. The reason why I had to speak briefly about brief psychotic disorder, I want you to appreciate the difference now. So with schizophreniform, you need the same symptoms, but you need at least 2 or more. And one of these symptoms must either be a delusion or a hallucination or disorganized speech. Look at the difference. We said for a brief psychotic disorder, we just need at least a minimum of 2. For a brief psychotic disorder, we need at least a minimum of 1 symptom. A minimum. It means we can have more. In the event that we only have 1 symptom, that one symptom must either be a delusion, hallucination, or a disorganized speech. But if you have got 2, one of those 2 symptoms has to be either this or this or this. Now, with schizophreniform, we need a minimum of 2 symptoms from the same 4 domains. But the difference is that So we need 2 or more, and we need one symptom that will either be a delusion, hallucination, or a disorganized speech. That's the first thing. Then now we can say, okay, for now we do meet a schizophreniform, but there are other things that we need to speak about to say that this is schizophreniform. The second thing that is also important with schizophreniform is that you don't need to have reduced in terms of functionality. You don't have to have a reduction in terms of functionality at work, at school, or you don't have to have a reduced social, maybe sociality, if I can put it that way. You don't have to have those for a schizophreniform. But for a schizophrenia, you must have a reduction in either work performance, school, or other things, other social things. So you must. That's for a schizophrenia. But for a schizophreniform, you don't have to have reduction in functionality here. That's an important differentiation again. The second differentiation, the third difference is that schizophreniform has to be 1 month to less than 6 months, which means that after 6 months, this patient must return to normal after 6 months. The minute they don't, then that becomes a schizophrenia. It's not that difficult, guys. It's really not that difficult. So they have to return. If you've got someone who's got these symptoms, but it's less than a month, think about brief psychotic disorder. Psychotic disorder. Think about that. So, stats says that 1/3 of these patients with schizophreniform, they do recover, while about 2/3 will go on to have schizophrenia. Or might even have schizoaffective. Another important thing now is that these symptoms must not be due to another psychotic disorder. They must not be due to a substance. They must not be due to medication, some kind of medication. They must not be due to another psychotic disorder. They must not be due to another medical condition. We are done with schizophreniform. If you were to tabulate differences, it's easy to remember stuff when you tabulate. Make a table, say brief psychotic disorder, because you know the symptoms are the same. So you put your symptoms there, and then you look at and then you differentiate now. Brief psychotic disorder, schizophreniform, schizophrenia, schizoaffective, like that. Then it's easy to remember. Even if now we were to make a table and differentiate schizophreniform from schizophrenia, it would be very easy to do that. Like I said, we are going to talk about schizophrenia now in the next video. Like I said, with schizophrenia, you will see that there's a difference here. The number of symptoms that you need for schizophrenia, that's the first difference. The second difference is that with schizophrenia, you need to have some kind of reduced functionality somewhere, be it relationships, be it school, be it academic. And also the third difference is the duration. So if they give you a paper case scenario with a patient who's got psychotic disorder symptoms that are related to a psychotic disorder, you look at the number of symptoms that you can pick up from that. How many are they? Secondly, you look at the duration of the symptoms. And thirdly, you look at what are the other things that the patient has. Do they have any reduction in work, social, and things like that? And also look, is there a mood component? Because if there's a mood component, it's likely to be schizoaffective. Let's meet on the next video, guys. Thank you so much. I love you.